And we now have an update on HIV patients in the territory who have recently been unable to get their medication. News Channel 8's Wes Small is there giving us an update on this story.
To dig deeper, today we're at VICARE to talk to the officials and representatives here to find out the impact in our territory. And now we are with VICARE, Mark Genovesio and Carmen George. They are two of the top people here at VICARE. They're going to give you just exactly their titles. But of course, we are talking about patients with HIV and AIDS and the meds that they desperately need to survive. And I don't have to remind you the percentage of people in our population with HIV. I believe it fluctuates between 10 and 20%, and that is a lot in our population. They can correct me on the figures if I'm wrong, but let's start with you, Mark. And what exactly does this mean to the territory, the fact that the meds, at least the funding for the meds, did not make it, and a lot of patients have gone without their medicine?
Well, the impact on the patients is extremely significant. Stopping medications at any time, whether you call it a holiday or a vacation from medications, gives the virus the opportunity to mutate, which means that the medications, when they do become available, may be ineffective for those clients. It may also affect medications that they have not yet tried.
All right, Carmen. And again, Mark, what is your title here?
I'm the Director of Prevention Programs.
Okay, Prevention Programs. And Carmen George?
Carmen George, and I'm the Director of CTR Services, which is Counseling, Testing, and Referral.
All right. What does this mean as far as the community is concerned with the meds, and are you working in concert with the local and federal authorities to make sure that your patients receive their medicine?
We have a very good relationship with the Department of Health. Of course, we have no control on how the medications are being dispensed. However, we do have clients that we serve under a program called HAPWA, which is Housing Opportunities for People Living with HIV and AIDS. And in that program, we have clients that were affected, not all, but some of them were affected by the lack of medication. And you can sometimes tell by their looks, which is something that is because probably some of them are pretty much advanced, and you can tell that they're not feeling very well. So our manager for that program inquired and to find out that what was happening in fact is that they had not received any medications. I don't know if you recall, about a year ago, VICARE took a stand and did a press release in St. Thomas in reference to this same situation. We are the only HIV/AIDS community-based organization, and we feel that we have to come out and fight and speak for our clients. And this just cannot continue to go on. And frankly speaking, Wes, I am very happy when I heard the news this morning that it was not something that was just going to be swept under the rug again.
Mark, let's get some statistics out. We rank pretty high as compared nationally. Where are we with HIV infection?
Well, the Virgin Islands ranks #2 in the United States for instances of HIV and #3 in the United States for instances of AIDS, based on a population of 100,000 people.
Per capita?
Yes.
So, in other words, we are in a dangerous situation.
Yes, we are. Approximately 1% of the entire population of the Virgin Islands may be infected with HIV or AIDS.
And 1% sounds very small and minute, but when you look at our population, that's pretty big. That's pretty big.
Currently, we have over 885 cases of HIV and AIDS in the Virgin Islands.
That is reported officially.
Yes, and it's estimated that 40% of those people who are infected with HIV do not know their status. They're not going to look sick. They're not going to know their status unless they do get tested, and many of them will not find out their HIV status until they do become sick.
They cannot afford a medical holiday. They can't, because it will just affect the whole trend, the whole thing that's going on in the body and in the system cannot be interrupted. And I, just so that the public can understand what we're talking about, I always try to compare it to something very simple: antibiotics. When you get sick and you go to the doctor, you get antibiotics for a certain amount of days. There could be shouldn't be any interruption there. The doctor says 5 days, then you have to take those antibiotics for 5 days. You can't put them down and say, I'll take one today, I'll try the other one next week. It doesn't work like that. But that's the concept that I'm trying to let the public realize as to what's happening with medications. That we are very protective of our clients.
News Channel 8 is all over the story. Let's make sure that people with HIV and AIDS continue to get their medicine. That just should not happen in our territory or anywhere. Here at ViCare in Christiansted, I'm Wes Small for News Channel 8.